Welcome back to the deep dive. Today we're digging into a set of informational materials from a single source, and our goal is to really synthesize a clear profile for you.
Yep.
We're focusing on a dental practice in North Dallas, CR Dental Group, which has gotten a lot of recognition.
That's right. And our mission here is to basically pull out the core philosophy, the full range of what they do. And I mean everything from a routine cleaning up to some really specialized work, and then the logistical stuff, the practical details.
We're boiling it all down so you know exactly what they offer.
And more importantly, what makes them stand out. I mean, they claim to provide comprehensive care, and we want to see what that actually means in practice.
Okay, so a good starting point, I think, is credibility. What did you see in the materials that stood out right away?
Well, the first thing that jumped out at me was the professional recognition. It's right there in the materials.
You mean the D Magazine Award?
Exactly. The practice and specific dentists there have been named among D Magazine's best dentists in Dallas.
Yeah.
That sets a really high baseline.
That's not just a patient survey, right? That's a peer review thing.
It's a peer review standard, which suggests a level of expertise that, goes way beyond just your basic general dentistry. It's other dentists weighing in.
Okay, so with that as a foundation, let's unpack their core identity. What's the main differentiator they seem to emphasize?
It's really that phrase they use,
Yeah.
a patient-centered approach.
And what does that mean practically?
Well, based on the text, it's not just about, flexible scheduling. It's about their whole philosophy.
Yeah.
They say they take the time to really understand your individual needs, your concerns, maybe your anxieties.
Which, let's be honest, is huge for dentistry. A lot of people have real anxiety about it.
A huge percentage of the population, absolutely. So they're focused on creating a comfortable atmosphere, making sure you feel heard and informed. It seems foundational to everything they do.
You really can't get good long-term health outcomes if the patient is too afraid to even show up for their appointments.
You can't. And that trust starts with the team. They highlight a core group of doctors: Dr. Jordana Ruiz, Dr. James Ryman, Dr. Monica Goff, and Dr. Alana Rifer.
And the recognition is specific to them, too.
It is. It's not just a general award for the practice. The materials note that Drs. Ruiz, Goff, and Rifer were all individually named on that D Magazine 2025 Best Dentists list.
Wow.
So when you have multiple practitioners in one practice getting that kind of individual nod, it says a lot about the consistency of their care.
Yeah.
That one-on-one attention they talk about.
It sounds like their goal isn't just to, fix a problem and send you on your way.
Not at all. It's about building a relationship. They talk about enhancing your overall life with a long-term strategy for your health. It's a holistic view.
Which is a perfect transition into the actual services, the sheer breadth of them.
Right. They really seem to want to avoid you having to go somewhere else for a specialty procedure.
Exactly. So let's walk through the three main pillars, starting with the absolute basics.
The foundation is just good oral hygiene. This is what their dental hygienists handle.
Yeah.
So your professional cleanings, of course, but also gum disease prevention and treatment.
And education, which I thought was interesting.
Very important. Empowering you with home care instructions so you can actually maintain the results between your visits.
Okay, so after maintenance, we get into what I would call the confidence builder, cosmetic dentistry.
This is where they help you get the smile you've always wanted. The sources list a few key procedures here.
Teeth whitening, of course. Dental veneers for bigger aesthetic changes.
Right. And also dental bonding. And the big one, Invisalign, the clear aligner system.
So they cover the main cosmetic requests. Then the third pillar is restorative treatment. This is about function.
It is. This is for fixing damage and preventing future problems. It starts with basic things like dental fillings, but then it goes up to crowns and bridges.
And this is where it gets more complex. They also list dental implants and root canals right there under their core restorative services.
And that's a key indicator of integrated care.
What do you mean by that?
I mean, they're not just farming out the difficult stuff. The fact that major procedures like implants and endodontic work like root canals are on their main menu suggests they handle a really full range of complex cases right there.
And the materials also mention laser dentistry.
They do, which reinforces that point about modern technology.
Yeah.
It's not a gimmick. It shows they're using tools like lasers to make procedures more precise and comfortable, whether it's for deep cleanings or other soft tissue work.
Okay, that makes sense. Let's shift now to the really specialized stuff, the services that often define a practice that's operating at a higher level.
Absolutely. This is where you see them treating issues that go way beyond a simple cavity. It's about full functional health.
The first one on the list is TMJ disorders. They offer diagnosis and treatment for that. For anyone listening who might not know, what exactly is TMJ?
So TMJ is a really common and often chronic source of pain. It involves your jaw joint and the muscles you use for chewing.
So like clicking in the jaw, headaches.
Exactly. You might get clicking, chronic headaches, face pain, sometimes even trouble opening your mouth. And because the way your teeth fit together is often a huge factor, a dentist is perfectly positioned to diagnose and manage it.
How do they treat it?
Often with things like custom splints or making adjustments to your bite. It's a huge area of expertise.
Okay, and the second specialized service is maybe even more critical for overall health, sleep apnea treatment.
Precisely. This is a big one. They offer custom oral appliances to treat obstructive sleep apnea.
And this isn't just about snoring.
No, not at all. Obstructive sleep apnea is a very serious health condition where your breathing is interrupted during sleep. A dentist can create a custom-fitted appliance that gently repositions your jaw to keep your airway open while you sleep.
Wow. So when you connect the dots between treating chronic pain from TMJ and a systemic issue like sleep apnea, it really does change the whole scope of what they offer.
It moves them from just reactive tooth repair to proactive health management that directly impacts your well-being.
And speaking of critical situations, the sources also highlight dental emergency care,
which is so important. They confirm they're available for urgent dental problems.
Here's a key logistical piece of advice from the material, though. They say same-day appointments may be available for things like severe pain or a broken tooth, but you have to call their North Dallas office early in the day. First thing in the morning is your best bet for getting seen quickly.
That is genuinely actionable knowledge, exactly what we're trying to pull out here.
Okay, let's pivot to the practicalities. A huge one is patient comfort. We talked about their patient-centered approach, but how do they actually deliver a relaxed experience?
They seem to get that a calm patient is necessary for successful treatment. So they offer a full spectrum of sedation options.
Let's walk through them. They start with the most common one, right?
Right. Nitrous oxide or laughing gas. It's described as very safe and effective, just for reducing that immediate anxiety and discomfort during shorter procedures.
Then the next step up.
That would be oral sedation. This is where you take medication orally before your appointment. It's designed to make you feel very relaxed, drowsy, but you're still conscious.
And for the most complex procedures, or maybe for patients with really extreme phobia, they have IV sedation.
That's the deepest level they offer in-house. It's administered intravenously for a much more profound state of relaxation. It's essentially monitored anesthesia.
So that range pretty much covers any level of anxiety a patient could have.
It seems to, yes.
All right, let's cover the final logistical details, the essential access information. Location.
It's very convenient, actually. It's in North Dallas, right at the Medical City Dallas campus. The address is 7777 Forest Lane, Suite C104.
Okay, but the office hours are really distinct. This is a key detail.
It really is. They only operate Monday through Thursday, from 7:00 a.m. to 3:00 p.m.
A very focused window.
It is. I mean, if you analyze that schedule, that focused 7 to 3 Monday to Thursday operation, it suggests they're built for efficiency and high-focus work. They seem to be prioritizing the quality of detailed, deliberate care over, say, extended evening hours.
That makes sense. And the sources also say they do welcome new patients for all their treatments and that they offer flexible payment plans and financing options.
Which covers the affordability question.
So to sum it all up, what's the big picture here? Our deep dive shows a practice that is, well, highly decorated by their peers.
Right.
They cover the full spectrum, from basic hygiene and cosmetic work like veneers, all the way to complex root canals, implants, and then these really critical specialized areas like TMJ and sleep apnea.
And that patient experience is clearly a top priority, with that personalized attention and the comprehensive sedation options we talked about. It all seems geared toward a long-term health strategy, not just a quick fix.
They're aiming to exceed expectations with attentive service and just making the visit comfortable.
Which brings us to our final thought.
Knowledge distilled. Mission accomplished.
And this leaves an important question for you to think about. Given this incredibly comprehensive nature of their services, we're talking everything from general cleaning to IV sedation and specialized TMJ and sleep apnea treatment, what is the hidden value for you as a patient in having all of that expertise concentrated in one single location?
Especially one that operates on that very focused, limited schedule, Monday through Thursday, 7 a.m. to 3 p.m.
Exactly. Does that focused availability actually signal a higher caliber of procedural quality that in the end justifies that scheduling trade-off? Something for you to mull over until our next deep dive.